Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton, and I'm excited today to bring on one of our brand new partners with Seniors Blue Book, Mr. Chuck Fultz, and he's with the company called My Care Manager. How are you today, Chuck?
Doing well, enjoying some of this cooler weather that we've had here in Florida as of late.
Yes, absolutely. It feels a little bit like winter, which is kind of rare around here, right?
For sure, for sure.
Wonderful. Well, thank you so much for your time this morning, and thank you for joining the partnership. Tell me a little bit about yourself and how you got into the industry.
Sure. I've been in the industry now. My care manager's been in the industry now for about 8 years, helping elderly folks in the Naples and surrounding communities age with grace and stay independent as long as they can. And then once they're not able to live independently, assist and advocate for them living in a community that is suited to their needs.
Perfect. Perfect. Now, care management, talk to us a little bit about what a care manager does on a daily basis to take care and advocate for seniors.
Absolutely, absolutely. So we we call ourselves geriatric care managers, or also known as aging life care managers. And we dedicate ourselves to enhancing the quality of life for our aging clients. We serve as really the eyes and ears for adult children who are not in the Collier County area, who need assistance with perhaps their mom or a relative that lives in the community and doesn't have any family nearby.
Sure.
So we're both an advocate for that person and his or her family, and an entire support system that including attorneys, trust officers, et cetera, to ensure a total approach to the care for the client.
Perfect. And transportation and things like that are so difficult sometimes for seniors. So getting to and from doctor's appointments can be a challenge.
Absolutely. And today, even scheduling those doctor's appointments with, hey, we're closed on a Tuesday or we're closed on a Thursday because of the virus or because of the physician's schedule, and trying to coordinate the various doctor's appointments, dentist appointments, lab testing, et cetera, can be quite challenging and time consuming.
Yeah, it certainly can. How long has your organization been around?
We were founded in 2013, and we've grown to approximately 8 employees over the course of the past 7 years.
Oh, wow. Okay. And how many are servicing the Lee and Collier County area?
All of them.
Oh, wonderful. Okay. That's a nice staff. That's great.
Yeah.
What other services do you guys provide other than your transportation and being that advocate for families? I've always used the expression, it's like having the daughter or son that you never had, as that actually knows the lingo and knows how to speak to physicians. So what are some of the other services?
Sure. I think the main thing that distinguishes our organization from others is that we have a 24-hour, 7-day-a-week hotline where if any of our clients have an emergency after hours, say they fall and they're in an ambulance on the way to the hospital, we'll meet them at the hospital and be there with them until they're either A, discharged, or B, admitted into the facility. So that's something that's a little unique with our organization.
So you follow them from home into the hospital, into potentially rehabilitation, and even help them with placement if they need to go into a senior living community.
Absolutely.
Perfect. Well, is there anything else that you want to add to today's interview to let us know a little bit more about Chuck?
Yeah. Well, I'd like to let you know a little bit more about our service, and one of the things that I think is a true benefit of having a care manager is we have the advantage of seeing what's happening in our clients' lives on a day-to-day basis. We're aware of their medical, emotional, and environmental situations. And because of that, our clients are vulnerable to being taken advantage of. They're vulnerable to fraud, and when you have somebody that's there with them day in, day out, and is an advocate for them, we can prevent those things from happening. Number one. Number two, when they are seeing a physician, you have somebody who's very well versed on that day-to-day activity, who
Okay.
can serve as an advocate at the doctor's office. And then lastly, when that client gets together with his or her adult children, um, they can be family, and they can talk about the grandkids. They can talk about what's going on in the family members' lives, rather than, oh, this is my daughter who used to be my daughter and is now my caretaker and now my doctor scheduler.
Yeah.
And it really relieves a lot of those burdens on the adult children, and results in a better outcome for the parent.
And when you have multiple family members that are trying to control one situation, it probably alleviates a lot of tension between families as well, because they have an expert looking out for their loved one versus the opposing opinions of 3 or 4 adult children.
Yes, exactly. And I can speak for many of our clients and their families. Is, they mom or dad tends to listen to a care manager who may have a master's degree in
Mhm.
social work, or a bachelor's degree in nursing, and they'll listen to that professional opinion, whereas a lot of times maybe the opinion of their adult child isn't given as much consideration.
Couldn't agree more. Well, thank you so much for coming on the show today, Chuck. It was really nice to get to know you. I appreciate your new partnership and look forward to working with you and getting the word out about what you do.